All right, hello. They're running a really tight ship here, so I'm going to go ahead and get started. My name is Patrick Quigley. I'm the CEO and co-founder of Sidecar Health. And so today what we're going to do, I'm really excited to share some of the data that we're seeing about how do you use healthcare transparency to empower consumers. So in case you don't know who Sidecar Health is, we're a full-stack health insurance carrier focused on the employer market. So we today insure employees in about 36 different states. So we have tons of data around healthcare transparency and how that kind of brings to market and some of the data we're going to show today. So I imagine if you're here, you guys are excited about transparency. There's a lot of news around transparency, as you guys, I'm sure know. So you always see probably once a month a headline about healthcare transparency. So not surprisingly, consumers, all Americans are pretty much interested in knowing what prices of healthcare are. Government regulation is catching up. I'm sure, hands in the air, you guys have heard of the 500 shoppable services, the No Surprises Act. All right. So we're, as a country, moving more towards transparency. We're even seeing traditional payers switch their models to more models that go ahead and enable people to know the cost of care. So what we've done at Sidecar Health is we've taken that a step farther. What we do is we are the only health insurance carrier in the United States that provides complete transparency on everything you can do in the US healthcare system. So there's 170,000 different things you can do in the US healthcare system. So we provide clarity around benefits, clarity around costs in every zip code in the US around those services so that our members can actually make good care decisions. We also, in addition to providing information, we provide incentives. We finally make it interesting for employees and members of our health plans to care what the costs are when they make decisions. And I'll walk you through a demo in a minute on how that works. We've also found that by introducing transparency, we are actually able to reduce the barriers to accessing healthcare. A lot of people don't access care because they don't know what care costs, right? Because they have a fear of a balanced bill. And so by providing transparency, again, we're able to break down that barrier. So in case you haven't heard of us, how does our model work? So it's pretty simple. It's very different than a traditional health insurance company. So what we do is we give all of our members a Visa card. This is not a credit card. This is a cash delivery mechanism. We basically give our members a card and say, you go pay for care with the doctors that you want, when you want it, where you want it. So we're basically giving them the ability to pay for care with cash. Turns out everybody takes Visa. I don't know if any of you guys have actually done this, but it works. A lot of times also cash prices are cheaper than traditional insurance negotiated rates. So that's very exciting. But giving people money is not enough. You also need to give them information. Because how many of you guys know what a knee replacement costs? Anybody? Right, it's difficult to know. So through our app, you can actually look up the cost of care so that you can make these decisions. And so we also don't have traditional kind of claims processing. After people pay for care with their Visa card, after they understand their benefits, all they do is take a picture of the bill. So it's kind of like, how many of you have expenses you're gonna have to do later this week when you get back? Right, you all do. So same thing, you're gonna take your little pictures of your receipts, of the places you spent too much money at, and it's gonna get loaded in. So that's how our system works. So after our members get care, they take a photograph of the receipt and load it up. So it's one thing for me to talk about, it's another thing for me to show you how this works. So I'm gonna have my colleague run it because they didn't have the lapel mics. Thanks. We'll show you how this is the consumer experience. Okay, so this is our mobile app. It has big buttons. It's blown up for a laptop screen. So let me give you a very simple example. Let's say you wanted to go fill a statin. So one of the most common drugs in the US is Lipitor. So we don't have a formulary, which I know as a payer is a crazy idea. We don't have a formulary. We don't do prior auth. We have this crazy thought that medical professionals have been trained to determine medical care, and financial institutions should not be making care decisions. So we simply let people decide, their doctors decide what care they need, and our members go get care. So for example, if you want to get the branded version of a drug like Lipitor, you can. It's going to cost more money if there's a generic. If there's no generic, we pay for whatever the specialty medication or the branded pharma that you're on costs. So in this particular case, if you want to save money, you would get the generic. So click on that. And so our experience is a little bit like GoodRx, where you can actually adjust your quantity, dosage, time. So it's like maybe you're taking 10 milligrams. What makes us different than GoodRx, but more importantly, different than United and Anthem and Aetna and everybody else, is this box over here. So we know what the average cash price is in every market for every medical service that you can get. And if you want to learn more about us, you'll find out. I'm happy to talk to you about how we do that. And we set our benefit amounts to the average cash price. So effectively what we're doing is giving our members $23 and saying, go fill your prescription and go wherever you want. So how it would work, and let's pick on some people because it's fun. So if you go so we're based in Ohio. So this is outside the Ohio State University. Let's say you wanted to go to CVS and fill your drugs. So how would it work? So this CVS on Sawmill is charging $96 for this drug in this quantity this morning. So we'll come back to whether or not you should be going there. But let's say you decide to because it's on your way home or it's, you work next door. So what you would do is you would come here to our app, you would get your group number and your BIN number, just like traditional insurance. You give it to your pharmacy. They ring you up for $96. You take out your Sidecar Health Visa card and you swipe. $96 comes from Sidecar Health's claims account and pays CVS. CVS doesn't even need to know we exist. They're done. They got the money they asked for. So the card is smart. It turns on at the pharmacy. It won't work at a gas station or a restaurant. It's specifically for medical services, kind of like an FSA card. And so you're able to pay for your care. At that point, your phone comes in. You take a photograph of the receipt, right? And that's when you got 90 tablets of 10 milligram Lipitor. And so that hits our system. We scan it and send you an email. And we say, hey, your benefit was $23. We gave you $23 for this drug. Your portion after that benefit is $73. So in the email that you receive, you have a button that allows you to pay that $73. Right? So it can come from your HSA account, bank account, credit card, whatever. And that $73 comes back into Sidecar Health's claims account. And you're done. So the interesting thing is, though, why are you paying $73 to get a generic drug? You don't have to go to this pharmacy. You can go anywhere. So it turns out right across the street is Meijer Pharmacy. Anybody ever heard of Meijer? Okay, so you must be from the Midwest. So it's a chain in the Midwest. So Meijer sells this exact same drug for $13. So in this case, what you do is you go and you swipe your card, $13 comes from our claims account, pays Meijer, Meijer's done. And then you take a photograph of the receipt, it hits our servers say, hey, your benefit's $23, and we send you an email that says, we just deposited $10 back in your account. So think about that for a minute. We just paid someone to get their care. So it's like a negative copay. And so if you go back and look at this map for a second, and you zoom out and you start to recognize care, the same care is dramatically different cost at different locations, but nobody knows it, right? And all we do is pull back the veil of what pricing is, and we enable consumers to make decisions on where they want to go. And what you may not know is that pharma is easy, but this is also the case for doctor services, whether it's as simple as a doctor visit, as complicated as a knee replacement, right? So let's say our benefit for a knee replacement is $75,000 in Columbus, Ohio. Some hospital systems charge $40,000 and they get $35,000 cash back. So we've seen incredible interactions with consumers using this model. It's basically treating healthcare like everything else we do in our lives. So if we switch back to the presentation, so let me go ahead and do this. Here's some data. So what do consumers do when they're presented with this new model of, hey, you just gave me money for my healthcare spend? I've never done that before. So this is real data from one of our early employers. So a construction company, right? So one of the questions we get a lot is, hey, this seems really different. It seems really hard. Do people get it? The answer is yes. So on the vertical axis here, you basically have the amount of money people spend relative to our benefit amount. Anything that's green is below the benefit amount. Anything that's gray is over the benefit amount. So in the first 90 days of this construction company being told about this model, given a Visa card and said, go get the care you need, what did they do? Well, 76% shopped around and got an average of $44 cash back to fill their drugs. That's like a negative $44 copay. It's incredible. Those that wanted choice, they ended up on average spending $15 out of pocket. That kind of sounds like a copay. So here's a world where for the first time, you give someone the information they need to make care decisions, you give them an incentive to make care decisions, and off you run. So I'll leave you with that, with our conclusions about what healthcare transparency has done. I mean, and first, we have certainly found that actionable transparency, and this is key, you have to have an incentive for people to care, enables consumers to shop for care and for them to they demonstrate they're willing to pay for what they value. People are willing to pay for above the benefit amount if they value what they're getting, not if they're not. We've also seen that consumers really do make the right decisions around getting cost-effective care, especially when you think about surgeries. Getting care at a surgery center might be a better decision than getting care at a hospital systems. And lastly, we've been able, with transparency, to break down access to care, because everyone deserves access to affordable, quality healthcare. And so that's where we think that transparency can go, and we're frankly happy to be part of the journey at Sidecar Health. So thanks so much all for your time.